7484. That's 352-861-7484. Hey, you've earned it. Call today. Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 18 minutes after 11 o'clock, not a bad-looking Thursday. Dr. Rabi Hanna is on the phone. He's board-certified in pediatrics and pediatric hematology, oncology, and he's the director of pediatric bone marrow transplantation at Cleveland Clinic Children's Department of Pediatric Hematology and Oncology. He's going to talk to us about hope and advances in childhood cancer treatment. September is Childhood Cancer Awareness Month. Dr. Rabi Hanna, it is an honor to have you on the show. Good morning, sir.
Good morning. Thank you so much for having me.
You are certainly welcome. How's Cleveland today?
Cleveland is sunny today.
Nice. And Central Florida is okay. Thank you very much. We were scared a couple of days ago that we might be blown away, but it worked out okay.
I'm glad that has not affected Florida, and my heart and prayer for the rest of the country.
Absolutely, yeah. It's not over yet for up north. So tell me about the advances and the reasons why. I mean, it's got to be one of the worst things a parent can hear is that their child has cancer.
This is really a very tough conversation whenever I have with any parents who have a child with a cancer. But I am really so excited to say that childhood cancer story is one of the true successes of modern medicine. Through the collaboration and research, more than 80% of children with cancer will survive. But unfortunately, that's not easy journey. I always tell our family this is going to be like a marathon, and it's long, so it's important to lean on other family members, other friends, and let them help when possible. And it is really take a village to help this family and their children whenever they fight the fight. And it's important to try to treat the patient as a whole, not just the disease. So we provide a lot of other multidisciplinary support of a music therapy, art therapy, so we could have the child remain a child and not let the cancer steal childhood.
How do you help the parents get rid of their guilt, like it should have happened to them and not their child?
It's an excellent question. The first thing I always tell the parents that childhood cancer is so different from adult cancer. It's not about the environment and what has been surrounding. And I tell them that nothing they have done has caused the child cancer. Most of the time it is related to genetic abnormality within the child, not meaning that they have a disease, but abnormal gene makeup within our cells can predispose to development of cancer. I wish we could find the cause of all cancer and prevent it, but right now we need more research to reach there. And the second thing I always tell the family so they can feel less guilty, it is really, it's not related to other environmental or other things around them, and that it doesn't matter if you came sometimes a week or two earlier, it is still curable and it wouldn't make a difference in the prognosis.
No, really? Does pediatric hematology oncology is that a specific type of cancer?
So in pediatric hematology oncology, we take care of blood cancers like leukemia, lymphoma, but we also take care of cancers from the kidney, from the liver, or even in other organs like the brain, because actually brain tumors are the second most common type of cancers in childhood.
When there's cancer of the blood, does it affect or infect the organs of the body?
Yes, unfortunately, the cancer from the blood, which is called leukemia, it will spread everywhere. So the staging that you may be familiar with 1, 2, 3, 4 doesn't apply here because the blood is everywhere, and that's why it tend to get more aggressive chemotherapy and treatment for this type of cancer.
Do parents immerse themselves too much in the research of the cancer that the child is diagnosed by going too much on the internet and things like that instead of speaking directly with the doctor and the medical professionals?
It's good, very important process. Whenever we talk to a new diagnosis, we tell them about the reliable information and resources that they can get. But we also try to really help them to connect with other families, other supportive group, other disease-specific group, so they can get reliable information. It is our duty as a professional physician and other group to guide the family, give them the information, give them the data, and tell them where it is a good resource. I found it specifically the support group to be very helpful for this family, not only just on the medical information, but also for practical information, resources within the community, and even just a peer-to-peer support. One of the things we are mostly proud of here at the clinic is the Fourth Angel organization, where it is volunteer of families and parents of kids with cancer. They can be available through online phone, so the other family could have the ability to talk to them and go through their shoes, what it worked for them, what didn't work, and help them through their own journey.
What importance, I'm trying to think of a good word here. When we donate blood, and we hear that blood is used, or at least platelets are used a lot for people with blood cancers, how much of a role do we, the general public, play in treatment of somebody with a blood cancer?
The advances that has happened in the outcome of childhood cancer, specifically leukemia, it is not only due to the chemotherapy, but also due to the supportive care, the availability of a blood, of a platelet, so patients don't die from bleeding. So I cannot emphasize enough on the importance of donating blood, platelet, plasma, anything you can do. It is really every little things matter, so we could help these children in their journey.
Yeah.
And how do you help a family maintain balance? Because if you have like a mom and a dad and then 3 siblings, and one of the sibling has the cancer, it's only natural to gravitate toward the sibling with the cancer, and the other 2 feel left out.
Oh, it's important. I'm glad that you brought that up, because I have witnessed so many times the family struggle with the stress that it is created with the childhood cancer. So we actually have a sibling program that can help talk to the other kids. We have a sibling event that could have like one dinner a month or even more frequently, especially in September. But we also even go to the school to talk to that school. Many times even the classmate can be affected. So it's critical really to try to treat the whole family and pay attention to the interaction, especially for other siblings that they may be suffering, and for the parents, because they may be working and try to find out the right balance. And we work with them to create what I call it the new normal until this will pass and the fight is over.
Will the child be living with his or her cancer for the rest of their lives? Or we never used to hear the word cure with cancer, but has that changed?
We are so excited and really proud to say we cure more than 80% of childhood cancer, so they survive without the cancer. But I am at the same time sad to say that unfortunately 2/3 of them, they will have long-term complication related to their cancer, either due to amputation, surgery, or sometimes side effect from the chemotherapy that could affect their cognition or some other organs. So it is our duty to find out, I think, newer therapy that could achieve the same cure, but with less toxicity on the long term.
And how about the everyday daily diet, not just for the cancer patient, but for the family themselves? If the patient's diet changes, should the family embrace that kind of a diet?
Yeah, I think nutrition is critical even for kids in their fight in cancer. We always emphasize on the healthy diet, especially more for the adult. It has shown to prevent cancers, and the association between obesity and others more common cancer like breast cancer and colon cancer. In pediatrics, it hasn't been associated as a cause nowadays, but it is really the more healthy nutrition as they are fighting the cancer, the better the outcomes for these children.
Aside from donating blood, that's always an easy one. Is there anything else that we, the general population, can do to help you treat the children that you're working with?
I think really the general population, we're so grateful for them because through research we make the advancement and the cure. And it's only 4% of the federal budget of the National Cancer Institute is dedicated to childhood cancer. So we have been relying increasingly on the generosity of non-for-profit organization and grateful public people who are donating to this cause to help us come up with a newer therapy that could advance the cure and have therapies with less side effect.
Dr. Rabi Hanna is our guest, and I want to make sure we have information for those who've turned up their radio because this is a topic interesting to you. Maybe you have a child in your family that is going through some kind of a cancer. What would you advise for them? Can they get information from the Cleveland Clinic?
I would invite people to visit our website. It is www.clevelandclinicchildrens.org and search for childhood cancer. And we have a lot of information about common cancers, but also for clinical trials for patients with relapsed diseases.
Well, you are doing an amazing thing, and I can't even come close to your achievements. Dr. Rabi Hanna, thank you so much for taking time. Thank you for saving the children, and keep up the good work. Thank you so much.
Thank you for having me.
You are welcome. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM,
I'm
The
Chris
Source.
Foster. More international aids arrived in the Bahamas for people needing it after Hurricane Dorian. The storm's off South Carolina now. National Hurricane Center Director Ken Graham says next.
Real close to the North Carolina coast and then out back into the Atlantic.